So after you come in for your first appointment, your therapist or prescriber might refer you to do the diagnostic screening. And so then the process is you get signed up for that, and you would come in for a 3-hour appointment. It generally doesn't take the full 3 hours, but we do schedule for 3 hours just in case to have that cushion, and there's a lot of variance from person to person. So you're here for 3 hours filling out the pen and paper assessments and the computerized assessments. From there, your psychometrician who you're working with will score the assessment, put all of that information into a report that your prescriber or your clinician will then go over with you in your result session, which typically is about 2 weeks after the testing. If you start getting anxious or inattentive or difficulties concentrating, we want to make sure that we're getting you at your prime. So you can take breaks, you can go and stretch your legs, walk around, anything like that. So there's nothing to be nervous about. It's not like you can pass or fail these tests or anything like that. We just encourage people to be as open and honest as possible so that we can get the best information from them to better give them a personalized treatment plan. So this is just one step in the process. So along with your information that you give us during intake and these scores on the test, and then how well you respond to medication and therapy, that's how we're going to be able to best give you the best, most accurate diagnosis. So this is only one part of the whole thing. So when you're sick and you go to a doctor, they can give you tests like MRIs and CT scans and stuff like that to better understand, what's going on with you physically. Unfortunately, there's not very many ways to do that mentally and with your emotional state. So that's what we try to do here, is just get that information from you in that sense. So it's unique to us because we feel that we want to be as accurate as possible, and meeting with you for 20 minutes and then writing you a prescription and sending you out the door isn't going to, give us any sort of valuable information. So that's why we want to really take the time to get to know you better as a patient so that we can provide you with the most accurate diagnosis and, just make sure that we are covering all the bases, because a lot of times there are different underlying comorbidities, meaning more than one symptom occurring at the same time. So if you present as inattentive, that might be due to actual inattentiveness or some underlying anxieties or depression or different feelings that you're experiencing that you may not even be aware of. When you come in for your result session, there's actually a report that you will get that your psychometrician will make for you, and it is comprised of the scores on all the assessments, a summary of what all those scores mean, and then a recommendations page where your clinician will give you what they feel the best form of a treatment plan is going to be going forward. So that you get to take home with you, so that if you ever forget or you want to look back and see what you scored on certain things, and even compare down the road, maybe 5-6 months after you're done with testing, you could see, oh wow, 6 months ago when I did testing, I had moderate anxiety, and now I feel like I don't have any anxiety at all. So you can kind of look back and see your progress over the time. So you get to leave with that tangible report, and you leave with that recommendations page of what will be best for you going forward.